Good morning, everyone. Welcome to the Headaches It's Not in Your Head Virtual Health Talk. This is the fourth webinar of the Health Talk series for 2021. My name is Diana Hualpa with the Hidalgo County Wellness Program, and I'm very glad that you joined us today. Before we get started, I want to make sure our technology is working for us today. If you can see the slides clearly, and if you can hear my voice clearly, please click on the raise hand icon that is located on the bottom of our Zoom webinar software. Okay, one more time. If you can see the slides clearly and if you can hear my voice clearly, please click on the raise hand icon that is part of our Zoom webinar software. Well, thank you so much. It looks like we're good to go technology-wise. I do have a couple of reminders before we get started. Reminder number one is that this month we have 2 additional webinars. Next week, we have the Tips for Smoking and Tobacco Cessation webinar. And at the end of the month, we have a professional development webinar. Therefore, if you haven't registered for this or any of our upcoming events, I invite you to do so through our wellness program website. Our second reminder is that you are on listening only mode. However, you are able to submit your questions via our Q&A forum on our Zoom webinar software throughout the presentation, and we will answer them during our Q&A session. At this point, I have the pleasure of introducing our guest speakers for today's presentation. Our first speaker is Rebbecca Escobedo. Rebbecca graduated from Texas A&M University Corpus Christi, where she obtained a Bachelor of Science in Athletic Training and continues to hold her license. Ms. Escobedo has been with Airrosti for the past 9 years as a certified recovery specialist, impacting the lives of patients from Corpus to the Rio Grande Valley. Our second speaker is Dr. Illiana Cantu. Dr. Cantu graduated from the University of Texas in Austin and got her Doctor of Chiropractic from the Texas Chiropractic College. She has been a certified Airrosti provider for 7 years and is passionate about providing the best soft tissue treatment to her patients to help positively impact their lives. And our third speaker is Juan Gaona. Mr. Gaona is the Director of Business Development for Airrosti Rehab Center, and he's passionate about developing strategies to lower the treatment costs and, most importantly, educate on a solution to musculoskeletal pain for South Texas. Without further ado, I pass it over to you, Juan.
Perfect. Good morning, everybody. Let me just go ahead and share my screen real quick.
Thank you so much for joining us, Juan.
Thank you. There we go. Can everybody see my screen? Good to go?
Yes, we're good to go.
Perfect. Thank you again for having us out here on this wonderful Friday on this great webinar. Like Diana mentioned, my name is Juan Gaona. I am the Director of Business Development for Airrosti Rehab Centers. We have a couple more people on the call that are going to come through with a couple of slides, but just like Diana mentioned, we have the chat is open for any kind of questions that you may come up with during the presentation or anything you want answered during the presentation, and we can go ahead and answer them at the end. But we do refrain from sharing any specific information about, personal health or anything, just to kind of keep everything HIPAA secured. We are going to have an option for VIP chats, and I'll talk a little bit more about that in a little bit. But it is an opportunity for you to have a one-on-one conversation with one of our providers in case you don't want to ask a question right now, or you think the question is going to be too long. You can have that time to jump in with them. So like we mentioned, we are from Airrosti Rehab Centers. For those of you that are not very familiar with Airrosti is a healthcare group of providers that specialize in resolving soft tissue injuries. That could be anything like low back pain, shoulders, knees, hips, bottom of the foot pain, anything from bottom of the foot pain, anything to the top of the head, like we're going to talk about today, headaches and migraines. We take an average of 3 to 4 visits to resolve most of these conditions. So our doctors use a specific hands-on manual therapy to get the tissue moving in the right direction. So these are some of the things that we treat in the office. So anything from, like I mentioned, headaches, migraines, plantar fasciitis, carpal tunnel. If you do not see what you have going on this list, doesn't mean we don't treat it, just means that we didn't have room for it on the list. Best way to find out if you are a candidate for Airrosti, if it is something, if you are dealing with something that we do treat in the office, is getting an assessment done. We do have the VIP chats available, like I mentioned. If you want to scan this QR code that's right here in the bottom, that's going to lead you to a schedule where you can get on there and talk to one of our providers for 30 minutes. Like I mentioned, we try to resolve most of these conditions in an average of 3 to 4 visits, no injections, no medications. Everything we do is manual therapy. So this map right here kind of tells us what traditional care looks like for musculoskeletal conditions. This is what I usually talk about in public, so with the group in front of me, so these questions may not be accurate, or I'm not be able to know what the answer is to these questions, but if I were to ask you right now, where would you go for tooth pain? Most common answer that we would get would be the dentist. But if I were to ask you, where would you go for an eye issue? Typical answer that I would get is the eye doctor, we hope, right? But if I were to ask you, where would you go for your lower back pain, or for tension headaches, or for neck pain? I guarantee you will get a variety of different answers. So we'll get like chiropractic, PT, orthopedic, ER, PCP, things that all of these providers are great and treat these conditions, but they have their own protocols on how to treat it. So if you go from different doctors to from one doctor to the other, a lot of confusion is going to happen, and a lot of cost, you're going to spend a lot more money than you would typically want to do. So that's where Airrosti comes in. We just specialize in soft tissue injuries or musculoskeletal conditions. So we do an assessment to find out what exactly is happening, and then we'll lead you to the places that you need to go. So if it is with one of our Airrosti providers, we'll give you that option. We'll tell you what it consists of, and then we'll go the needed steps. But let's say you're coming in for a shoulder issue and something is actually broken, fractured, maybe you have a torn tissue or muscle. We don't treat those things in the office, so we won't even charge you for that visit. We'll just tell you what we found, and then we'll direct you to an X-ray, an MRI, maybe to your PCP, and we'll go from that route. But we are a first step to hopefully save you money, because if you were to come in for that shoulder injury and it turns out that it's just inflammation or it's just a tight muscle, you don't have to spend that extra cost by going for an X-ray or MRI. Like I mentioned, these VIP chats are no cost, so it's an absolutely free program for anybody that wants to do it. So I know we're on this call right now for all Hidalgo employees, but if you have dependents or you have somebody else that's under a different insurance, doesn't matter. We don't even collect insurance information. It's just a free chat that you can have with one of our providers. So again, scanning this code right here will give you the opportunity to schedule an appointment with one of our providers there in Edinburg. So on the route of what we're going to talk about today, so today we're going to talk about understanding what different types of headaches look like. Like I mentioned, we do treat headaches and migraines, but what we really do is we find out what the root cause of that headache is. Dr. Cantu is going to walk us through a couple of things right now, or different conditions, on how we can know which type of headache or migraine we're dealing with and when is it a good idea to come in and see Airrosti. And then we're going to talk to Becky. She's going to put us through, a couple of stretches and exercises to help us on postures, on how to be, better posture at work, even at home, and how to impact a lot of these stretches and exercises. And then we're definitely going to talk about tools for prevention and tracking. So I'm going to pass it over to Dr. Cantu to see if she can walk us through types of headaches. I know she was having some connection problems, so if she doesn't come on, I'll go ahead and walk us through it.
All right, good morning, everybody. Can everybody hear me?
Yes.
Can you hear me? Okay, perfect. All right, so yeah, like Juan said, I'm going to be taking you through some of these types of headaches, trying to give you some of, some details on them, just to kind of tell you if, if you are dealing with something like this, if it's something that you would need a medical referral for, you need to see a specialist, a medical professional, a medical doctor, or it's something that you can come into Airrosti and get treated in a few visits and get rid of your pain. So just an outline of what we're going to be going through. The first one is going to be a TMJ sort of headache. It's going to be coming from the jaw. The pain is going to be around the ear, temple, side of your face. Then sinus headache is going to be more in the area of the forehead, right behind the brow bone, even to the cheekbones. Cluster headache is going to be around one eye, one-sided, maybe side of the temple as well. tension is going to be a little bit different. It's going to be all around your head. It can be like a tight band squeezing the top of your head, even a little bit of pain down in the back by the occiput, all the way in the back by the neck, because it is coming from tension from the neck a lot of the times. And then migraine headache is typically on one side of the face, but in addition to neck pain or head pain, you're going to feel or can feel other symptoms like nausea, visual changes, flashing lights. So a lot of different things that can come with a migraine headache. And then the other type of headache is coming from your neck completely, a cervicogenic headache, something going on, an injury to your neck, or something, tightness going on in your neck that is causing the pain into your head. So we're going to go into detail on some of these in the next few slides here. So the first two types of headaches we're going to talk about here are going to require you to see your medical doctor. The first type is the sinus headache. That's going to be if maybe if you've been sick or you have allergies, it's going to inflame the sinuses. It's going to cause irritation to the sinuses. This does not have a musculoskeletal component, which means it's not coming from neck or tight muscles or anything like that. It's inflammation through the sinuses that would require you to get some medication, possibly from your medical doctor. The next type of headache is a cluster headache. Again, this is on one side of the face, around the eye or the side of your head. And this is going to be one of the most severe types of headaches, one of the most painful types of headaches that you can get. It's going to last about 15 minutes to 2 hours, and it comes in, just like it says, in clusters. So you may have frequent attacks for a few weeks where you're just having several headaches throughout the day, and then you'll go through this period where you don't have any headaches, almost like a period of remission, and then again you'll have another bout of frequent headaches coming. And then this type of headache can be associated with other symptoms such as watery eyes, nasal congestion, and swelling around the eyes, which may mimic an allergic reaction. But the difference would be that it comes in those waves of frequent attacks, remission, and then coming back. All right, and again, this type of headache is going to require you to see your medical doctor for possibly some medication. The next type of headache is TMJ. TMJ is temporal mandibular joint. That is the joint in your jaw that's going to help you open and close your mouth. So a lot of the times when we go to the dentist, we have our mouth open for a long time, or we have some of those dental issues where we have an overbite or an underbite. This may cause some irritation to that joint. Some people grind their teeth at night, and that could come from, stress or other stressors throughout the day, and you won't really notice it throughout the day. But if you're grinding at night, that's going to cause inflammation to that TMJ joint. And then trauma, of course, if you have a hit or a blow to, your head or neck, this can cause some damage to that joint, which will give you pain and irritation to there. So pretty much it'll be a pain when opening and closing your mouth, pain around your head and ears. And because of there's a little disc, they call it a discoid. It's almost like if you think about a disc in between the vertebra and your spine, same sort of idea, but that disc could get stuck in that joint or get into a position where it's compressing the nerve, which could give you even more severe pain around the jaw. A lot of the people that get braces will commonly have this sort of pain, that TMJ pain that will cause that type of headache. So this is a type of headache that we can see in the office. We would have to assess it, go through the exam and see, what is actually going on. Is it just the disc? Is it the muscular structures around your face, neck, and head that are causing this sort of pain? Because very common cause of this sort of pain is going to be coming from posture or neck. So that would be something that would require an exam before assessing which muscles we need to work on to relieve this type of pain. Great. Next headache is tension headache, of course. I think everybody experiences this type of headache at one time in their life or another. It's going to be caused by, stresses, postural, especially if you're sitting in front of the computer for a lot of your day. You're going to be kind of leaning forward, putting a lot of stress on some of these areas around your head and neck. And you'll feel that pain, that tension, usually around your head, almost like a band. People will feel pressure and tightness. You'll have tender spots throughout it because it's coming from the muscle. If you push on those muscles that are tight, they'll cause some of that tenderness, and some of those areas may be all the way into your shoulders even because of how the muscles are connected from your head, neck, and into your shoulders. And it's more of a dull, achy pain, but definitely managing your stress, trying to relax as much as possible, some breathing techniques, meditation, that's going to help kind of relax some of these muscles, take the stress down. And as well as manual therapy, rehab, and stretching, which is the stuff that we do at Airrosti. And again, we would have to go through that evaluation and see what exactly is going on, which muscles are involved, and rehabbing it specifically to what you're feeling so that we can rid you of this pain. All right, the next type of headache we're going to go through is migraine headaches. And migraine headaches is a little bit more complex. There are different types of migraines that can come from different types of symptoms. There are different triggers. Some of the different types of migraines that people experience are going to be, of course, the common migraine. That's the most classic type of migraine that you're going to see. It's the classic type of symptoms that people think of when you think of migraines, like flashing lights. You're going to have visual, sensory, and speech deficits. So you may be sensitive to light or sound. You'll have a throbbing pain on one side of the head. Some people experience nausea and vomiting. It's going to be made worse by physical activity. That is typically the migraine that people present with. But of course, there are complicated migraines, which is the next type. That's more complex. It's a more serious type of migraine that's going to resemble more of a stroke. It's going to have more of a neurological deficits. You may not be able to do certain things, but it's temporary. I'm sorry, that one can be more long-term. So that's why it's more debilitating and more serious, which would require you to see your medical doctor. The retinal type of migraine is going to be more of that eye condition that's more temporary. So that one is going to be flashing lights. You can even have temporary blindness. That's going to be super temporary, short-lived. It's not going to last. Once your headache goes away, it'll go away as well. Chronic type of migraine is going to be sometimes people have this type of migraine all their lives. So they'll see that there are headaches at least 15 days out of the month. Their headaches are going to have migraine sort of symptoms at least half of that time. And for it to be chronic, we're going to see that it's going to be around at least 3 months. But typically people are going to have it for several years, if not a large part of their life. The last type of migraine on here is going to be a migraine without head pain. So people with this type of migraine, they're going to experience all of the symptoms of a migraine, like sensitivity to light, flashing lights, kind of like that aura, sensory deficits, maybe nausea, vomiting, but there won't be any head pain. So that type of headache, again, would be treated with medication, and it would, and with a lot of these migraines, treatment is going to be best if we can identify the triggers. So the next slide here should show us a few of these triggers that I'm talking about. So sometimes it's not just musculoskeletal sort of triggers like tightness in your muscles. It's going to be more hormonal changes certain times of the month. Some women experience migraines, during their menstrual cycle. Food, sweeteners, dyes, artificial dyes that are added to food. Sometimes people are very sensitive to that and it'll give them a migraine. Drinks such as alcoholic beverages, caffeinated drinks, that's going to be a big trigger for a lot of people. And of course, changes in sleep. If you don't get some rest, you're going to be more prone to getting a headache in general, but definitely a trigger for migraines. Changes in pressure, barometric pressure, such as the weather. So sometimes when it rains, you're going to have changes in that pressure, which a lot of people will say, like, anytime it rains or anytime it's cold, I'm going to have a headache, and that will trigger their migraines. Of course, medications have several side effects, but there are some specific type of medications such as oral contraceptives and vasodilators, which can cause migraines. And everyone's a little bit different with these other sensory stimuli. Some certain smells, certain foods that people eat are going to be triggers. Just smelling them sometimes are going to cause them to have a migraine. Intense physical exertion, if you have headaches after exercise or extreme physical activity, this is going to be a very common migraine trigger, as well as stress. And it's very hard to control stress, but a lot of times if you can just monitor your stress levels and what you're doing throughout your work or home life, you can determine if stress is one of your triggers. All right, and the next type of headache is a cervicogenic headache. So cervicogenic headaches is going to be a headache that has a connection to the neck. So there's either an injury to the neck, or there is something going on, tightness, pain in your neck that is going to cause someone to have a headache. So just because you have neck pain doesn't mean you get a headache, but sometimes the tightness in your neck is going to cause irritation in these structures that we have back here. So in the back of the head and neck, we have not just muscles, but vertebra and joints in between those vertebrae, as well as nerves that innervate the head and the face, that any type of inflammation through any of these areas could cause the headaches into the face and head. And a lot of these times they can mimic a migraine headache. But what we have to do with these types of headaches is, when you come into the office, really assess where the pain is coming from. If there is a musculoskeletal component, then if there's tightness, if there's decreases in range of motion and things like that, then we would be able to identify that part of what you're feeling, at least into your head, is coming from your neck. All right, so some of the symptoms that people may present with in the office coming in with a cervicogenic headache is going to be neck stiffness, loss of range of motion. They're not going to be able to turn or look up or down. That's going to trigger some of that headache, pain, some deep neck pain. Even if you're not experiencing some neck pain, a lot of the times there will be tender points on the muscle that we can push on that will trigger, kind of refer that pain to the head or cause that headache. And that's how we'll know that what you're experiencing in your head is coming from your neck. A big contributor to what people feel with cervicogenic headaches is going to be the posture. Anytime where we have our head kind of leaning forward, it's going to put a lot of stress on the muscles, nerves, and discs on the back side of our neck and head. And any stress to those structures back there are going to make you more prone to getting a cervicogenic headache. Again, the triggers for this are going to be pain in your neck that goes to your head, And then sometimes people will come in saying that they did a certain activity, like a certain exercise that triggered the neck pain, or they came in and said they slept wrong, or they were in a position, the same position for a very long time. Like I drove for a really long time, or I sat in front of my computer for 12 hours. We're seeing this a lot with everybody kind of working from home now. But that big stress forward, like as the head leans forward, the more forward you're leaning, the more stress you're going to be putting on the vertebra, neck, and all the structures that come in and connect into your neck, which could trigger more of a headache. All right, so treatment for this type of headache is going to be manual therapy, manipulation, like adjustments, stretching, icing, rehab, physical modalities such as like muscle stimulation or ultrasound, and such as like ibuprofen and naproxen. So these are the types of things that we do here in the office. So here at Airrosti, we do manual therapy followed by active care. So some of those stretching, icing, and rehab exercises that we do here are really going to help this type of headaches. And this is primarily the type of headache that we see here in the office, and that we have really good results treating, because it is coming from a musculoskeletal component that we can get rid of and give you a lot of relief fairly quickly.
Good. Thank you, Dr. Cantu, for walking us through all those headaches and different types of migraines. I think one of the key points that we can take away from Dr. Cantu's presentation is there's many ways or many reasons why we could have pain in our head. But if you want to, if you have questions, or if you tried other options and you still don't know where to go, we can always be that starting off point for you. Come in, get that examination done with Dr. Cantu so she can find out, where exactly is it coming from. Like she says, a lot of the symptoms are going to direct where we're going to go with care. But one of the ways that we can kind of start getting rid of some of this pain is by being proactive. So the first thing we're going to talk about is, posture awareness. We're going to have Becky walk us through a couple of stretching and strengthening exercises that we can do. And then we're also going to know how to track some of these triggers. So we already gave you the answers. We just need you to find out where they're coming from. So first thing, of course, that I wanted to make sure that everybody knows is the kind of like posture awareness. So I know we've been on this presentation for about 20 minutes now. So if you are in this position over here on the left, let's kind of correct it and come back to this position, okay? I know it's tough. I know it's hard throughout the day to make sure that we are, in an upright position. We're not leaning over, our feet are not dangling off, but it's something that we have to make a change for, especially now, like Dr. Cantu said, working from home or having more things like this, like webinars now. We want to make sure that we take these precautions or take care of, so that the headaches and migraines, even other stuff like upper back, shoulder pains can occur from being in a bad posture. So what I'm going to do next, pass it off to Becky to walk us through the first one.
Hey guys, can you all hear me?
Yes.
Okay, so the first one, they are stretches for the neck. So you're going to start off sitting down, and this one you can do at your desk. You don't have to be sitting down. You can even do it standing up. But on this one, you can tell there's going to be 3 different positions, okay? You're going to start off with putting one hand under your chair. Where your hand is, you're going to lean your head to the opposite direction. So that's going to be the first picture. So as you're holding that, you're going to feel that stretch from here down the side of the neck and into that corner part of the shoulder. This is the trap stretch. All stretches you want to at least hold minimum 30 seconds. Ideally a minute, but sometimes if the muscle's too tight, you're not going to be able to get that. So if you have to, break it up into segments, okay? For the second part, from this position, actually what we're going to do is still holding the bottom of your chair, you're going to swing your nose down and you're going to look at the floor, kind of like you're getting that corner of your shoulder. This will slightly change the direction of those neck muscles that are being stretched. You're going to feel this from corner of the bottom of the ear to that collarbone. This stretches the SCM muscle, okay? And again, holding it 30 seconds or so. And then from this position, this one gets a little bit tricky. But from here, still, we're going to follow our nose and we're going to actually look up towards the light. As you look up, you're going to be twisting your head you're gonna feel that pull a little bit from under the jaw to the little bit anterior portion of that collarbone. And then as well, you're gonna hold it at least for that 30 seconds to a minute. And then of course, if you do one side, always switch to the other side.
I'll jump in here real quickly and just mention if, we're encouraging everybody to try these stretches and exercises right now that we are doing this presentation, but definitely take these with you to use throughout, the work week. If you have any numbness or tingliness or sharp pain with anything that we're giving you, just go ahead and come off of it, maybe reset and then try it again. If you still have that ache or pain, then just don't do this exercise.
All right, next one is the seated neck retractions. So this one's going to emphasize on the muscles on the back of the neck, back of the neck, base of the head, going to that upper triangle portion of your neck, okay? So with this one, you're going to sit up nice and straight, and you can see she is pulling her chin to her neck. You are purposely giving yourself a double chin. So as you're gently tucking your head back, and then you'll just gently let it go back into that neutral position. If you feel like you can't do it, you can even interlock your fingers, place them behind your head, and then use it as something to feel. So you're going to push your head into your hands, hold it 1 to 2 seconds, and then gently release. And number 3, scapular retraining. So this happens to do a big one with posture. So those muscles between your shoulder blades that attach to your spine is what kind of gives us that forward rolled position that everybody gets, sitting in front of the TV or the computer. So this exercise starts retraining to get you back into a proper posture. So just standing up straight, and you're going to squeeze your shoulder blades. Imagine there's a pencil and you're trying to squeeze it with your shoulder blades. You're going to squeeze, hold 2 to 3 seconds, and then just gently let go. And you should feel those shoulders come together and then release. The first few times it might feel really tight and tender. You might even feel stretching into those pecs, but slowly work into them, and then it'll get a lot gentler and a lot easier. And you'll even notice it actually gives you a relief feeling. And this, 10, 15 times repetition, and you can do it a few times throughout the day. And especially if you're a desk jockey that you can spend hours at your desk before knowing, these are just great little tricks and tips to just break up that day and get you moving a little bit better.
Yeah, that's perfect. Thank you, Becky. But yes, like Becky mentioned, these are great things that you can do throughout the day to kind of break away from the position that you're in. Again, just a reminder, if you feel any, numbness, tingliness, sharp pain, let's go ahead and stay off of these stretches. Don't make sure you don't do them. You might feel some, tightness. You might feel some, popping going on in the muscles and tissues. That's absolutely fine. As long as you don't force that pop, then I think you're fine. So just make sure to keep those tips in mind. So like I mentioned at the beginning, we did give you all the answers. So Dr. Cantu walked you through, what the symptoms are, what, the triggers are, kind of things like that. But we want to make sure that you have a tool to help, track this. So this is something that you can use to bring in, for us, or to bring this in whenever you see your PCP. So a great way to do it is just, put your date, the time, you can pick a location wherever you felt the pain, the activity that you were doing, severity of pain, duration, last meal, and then what helped. So this is everything that we kind of walk through symptom-wise. So this is a good way to track this information and keep it with you. So I'll send a copy of this to Illiana, and then she can go ahead and send it out. Or if you just want to reach out to her, you can get a copy of that to you too. Feel free to make copies of this, and make sure you have some on site or on with you, or if you want to share this with anybody else that you know. All right, so just some quick information about Airrosti. So like I mentioned, we take care of all soft tissue and musculoskeletal injuries. So as of right now, we've seen over 1 million patient cases. So this little number right here is a little outdated right now, but like I said, we take care of them in an average of 3.2 visits. So it's about 3 to 4 average visits to injury resolution. One of the big numbers that we're proud to share on here is that we've been able to prevent over 15,000 surgeries. So these were all patients that were recommended some type of surgical intervention to get rid of the ache, the pain, the condition that they were dealing with. Came to Airrosti, went through the evaluation, went through the assessment, went through treatment, and then at the end of all their appointments, felt like they no longer needed that surgical procedure. So this is huge. I mean, this is a big deal because it's not only saving you money, but it's also saving you time. So we want to make sure that you spend as much time with your families and going through all of that. So this is definitely going to help with that, with avoiding any kind of surgical procedures. Some of the other numbers on here is that we've been able to report a full recovery on 88.3% of our patients. But we compare that to 99.6% of patients that would recommend Airrosti to friends and family. You might be thinking, well, why is there an 11% difference between those that you help versus those that you actually that will recommend, Airrosti? And the true answer is that we did right by that 11%. They came in for the assessment. We walked them through what we found. We let them know they're not a candidate for Airrosti, and we got them in the right place. So again, we're not here to waste your time and waste your money. We want to make sure that you get the answers that you need and the treatment that you need. So we want to make sure you get it as fast as possible. Again, this is just a reminder of everything that we treat in the office. Again, we're here talking about headaches and migraines, but we do treat anything like carpal tunnel, plantar fasciitis, back pain, shoulder pain. A big reminder on here too is that you do not have to have a diagnosis to come and see us. So you don't have to have seen your PCP or chiropractor or anybody else to come and see us. We are direct access. And you also, like I said, you don't have to know what you're coming in for. You can just come in and point to Dr. Cantu and say, this is where it hurts. That's her job. She's gonna do the assessment and find out exactly what's going on. So when it comes to Airrosti, where we're located, we have 3 locations down here in the valley. So we have one in Edinburg. So that's where we have Dr. Ramon and Dr. Cantu. And then we also have our new location here in Harlingen. It's right off of the expressway. We have Dr. Cervicogenic and Dr. Badazo. And then we have a location in Brownsville as well with Dr. Lara. All of our appointments are an hour long. So if you're scheduled at first thing in the morning, like let's say 9, you're in at 9 and you're out by 10. We're always on time. So we always recommend that you pick a time that is more convenient for you to come in, because you will be with us for that full hour. It's going to be 30 minutes of assessment and manual therapy with Dr. Cantu, and then it would be 30 minutes of rehab with Becky. Both of these are very important. We want to make sure that we, build on the tissues and muscles that Dr. Cantu was working on. So it's very important that we do the rehab side of it as well. But the good thing is too that all of our clinics work the same way. So let's say if you work in Edinburg but live in Harlingen, you can get treated where you work, or you can get treated where you live. You can kind of pick up, appointments wherever you need to. So it's very accessible. All of our appointments, all of our offices right now are taking all COVID precautions. So everybody in the office is wearing masks. All patients have to wear masks. We're sanitizing the rooms after every single patient comes in and out. And then the good thing is that we don't have, many people waiting in the lobby. We'll just have 1 or 2 also masked up. One thing to mention is that we do not take walk-ins. So if you want an appointment with us, best way to do it is to call this 1-800 number right here. That leads you to our corporate office in San Antonio. That's where they take care of all of our scheduling, all of our billing. The doctor's job in the office is just to treat. So you can't come in and request an appointment. It's all done through our 1-800 number. You can also schedule online through Airrosti.com. You'll submit all your information. And again, somebody from our San Antonio corporate office will call you to make that appointment. There's also a QR code right here. If you want to, this is where you want to go. You have some questions. You can go ahead and scan this, and it'll lead you to an appointment page right now. I'll go ahead and come back to this in a little bit. Oh, this is not ours. So again, thank you again for joining us. There was going to be some questions towards the end that we're going to answer. So in case something comes up where we didn't answer your question, or you want some more information, you can always email me. That's my job. I will, relay all the information to our providers and get you where you need to. But my email is pretty simple. It's juan.gaona@airrosti.com. You can even scan the QR code right here, and that'll lead you to all of my information as well. I'll go ahead and leave the VIP chat option right here open, so you can scan in with your phone. But I think Deanna's going to walk us through a couple of the questions on here.
Thank you so much, Juan, and thank you so much, Airrosti team. At this point, we're going to start with the Q&A session. As a friendly reminder, you can submit your questions using the Q&A forum that we have in our Zoom webinar software. And we already have some questions, and let's go ahead and get started. The first one is, what do you think about the upright posture device or posture brace?
So with the postural brace, we don't like to recommend those for long-term use. What we prefer to do is to create a natural brace to strengthen the muscles that brace would pretty much activate, or not activate, but kind of force into a position. Because if you rely on the brace for too long, then the muscles under it are going to weaken. And then your actual muscles aren't going to be able to do the things that they're supposed to do. They're not going to be able to bring your shoulders down and back. So you'll actually create more of a weakness once you take it off. So instead of putting on a brace, we recommend strengthening up your muscles in the position the brace would be putting you in, so that you will feel more strong and stable.
Okay, great. And our next question is this covered by Aetna, which is our county's medical insurance? And I'll go ahead and take that one. Yes, this is a benefit that is covered through the county's medical insurance. You do have to pay your copay as a specialist, but it is in network and it's completely covered with the county's medical insurance. And I know we do have a couple of questions if what other insurances you take. So I don't know, Juan, if you want to expand a little bit on that.
Yep. So we do take all major insurances. I think the only thing that we're not in network right now is TRICARE and Medicaid. So if you have, the best way to find out if you are covered with, or what your copay is as Airrosti, is to call that 1-800 number that I showed earlier, 1-800-404-6050. Give them all the information you have insurance-wise, and somebody from our corporate office in San Antonio will reach out to you, let you know exactly how much visits 1, 2, 3, 4, 5, whatever we need are going to cost you, and then you'll know how to come into the office. Now, we also do offer a payment plan, so in case it's not covered by your insurance, we do offer a payment plan where you would pay $50 a visit plus $50 a month, and then once you're discharged, we'll give you 12 months to pay that off interest-free. That is done through us. That is not done through a bank or any other kind of credit card system. You would just be signing an agreement with us.
Well, thank you so much. And the next question is, do you refer people to a neurologist or surgeon if it is needed?
Yes, so if during the exam it turns out to be something that we cannot help you with, right off the bat, we're going to give you a referral to see a neurologist or a surgeon. Of course, that is also the case if we go through a treatment, and we're going to let you know right away that it's something that you're not responding to, we will send you to a medical provider or a specialist if needed.
Okay, perfect. And the next question is, if someone suffers from a herniated disc, can Airrosti help?
Yes, it can help. We treat a lot of people with herniated discs. It would depend on the severity of the herniation, of course. So we would, again, do an evaluation. We see if there is a muscular component to it. If there is a musculoskeletal component, then people do respond really well. Sometimes people have herniations in their discs, and it's a normal variant. It's not the cause of their pain. So that's what we would have to determine at that first visit. Do you have like the symptoms that go hand in hand with the disc herniation, like the numbness, the tingling, the loss of sensation? If that's the case, it may be a little bit more serious and may not respond as well. But if there aren't a lot of those type of symptoms, Airrosti can help with what people are feeling, even if there is a disc herniation.
Okay, and I guess as a follow-up question, the next one is, will the neck exercises be the best thing if you have a herniated disc in your neck?
The exercise, if you're referring to the exercises in the PowerPoint, the exercises we went through, they're pretty much stretches, and the neck retractions are completely safe for somebody with a herniation as long as you're not in an active flared up state. So if you know you have a herniation but you're not in severe pain or have severe decreased range of motion, then these are completely safe to do while you have them. Of course, if you have something more serious, then it's best to get evaluated, and then that way we can give you a custom plan for you Just because you have herniations doesn't mean you can't feel better with the exercises. We just want to make sure that they're safe for you.
Okay, perfect. And the next question is, are x-rays in-house?
So we do not have x-rays in-house. Most of the time we don't end up having to take x-rays because we do a full exam that gives us a really good idea as to what's going on. Of course, if we require x-rays, and that would only be like if we suspect a fracture or something, there was a big trauma or something where a fracture could come into play, then we do send out for x-rays.
Okay, perfect. We do have a couple of questions, or how can we get a copy of the slides? This presentation is being recorded and it's going to be also part of our Hidalgo County Wellness Program website. And as Juan mentioned, we will have that presentation available as well.
I'll just jump in real quick. I saw one question come in through one of the chats on TRICARE. It is something that we are currently working on. Hopefully in the near future, we will be able to get that covered. The best way, again, to see where you fall within your benefit is just call that 1-800 number. If you have TRICARE, I'm pretty sure we'll send out a notice to everybody that has it, that letting them know that we are a benefit under your insurance plan. But like Dr. Cantu mentioned, it's always great to come here as a starting off point and then finding out what steps we need to take. If it is with Airrosti, we'll figure out what we need to do to get you treated by Airrosti. If it's somewhere else, then we'll figure out how to get you there as well.
Great, Juan, thank you so much. And the next question is, do you deal or do you treat lower back pain?
Or just headaches?
We do. We treat all types of musculoskeletal conditions. And pretty much head to toe, we treat back pain, neck pain, knee pain, hip pain, ankle, sprain. We did really good with sprained ankles, some other stuff like carpal tunnel. Also, a lot of people have some forearm or wrist pain with typing. We treat that sort of pain as well, because a lot of the time it's not true carpal tunnel. It's more of a musculoskeletal component that we clear up, and people have a lot of relief from it. And it all goes back to the evaluation. If we can go evaluate and see what's going on, if it's a musculoskeletal problem, then we can help you with it.
Amazing. And just the next question is, and just so we are all on the same page, is do you treat teens?
Yes, we treat all ages. What we do, it's a lot of pressure. As long as the child understands that it's going to be a lot of pressure, we've treated as young as, I think in this office, probably like 6 or 7, but in other offices, they've treated even younger. So it all depends, like as long as they know that we're going to be putting a lot of pressure through these tissues. But teens, definitely, we see a lot of the middle school and high school athletes, is a lot of the dancers and stuff that, around town that are dealing with this type of condition.
Okay, well, thank you so much, Doctor. And thank you all for joining us this morning. Thank you, Rebbecca, Dr. Cantu, and Juan for this informative presentation. And thank you all again for being here with us. I really appreciate your time here, your engagement, and all the questions that you submitted to us. I hope you have a great day, stay safe, and stay healthy. Thank you so much.
Thank you.
Thank you, everybody.
Right.